that then. Okay. So I just want to thank you very much for allowing me to conduct these interview questions. It's really going to help me out in my final capstone project. And so just to introduce you really quickly, for those of you who don't know, you so I have here Dr. Danielle Colayco, who is a PharmD and also has her Master of Science, and she is the Executive Director of Komoto Family Foundation. So the purpose of this interview is to learn about the organizational leadership, the goals, communication strategies, and the service gaps. So with that being said, thank you so much again, Danielle. We're going to start off with the first question. And so the first question is if you can give me a little description about your role in this healthcare organization.
Yeah, so I'm the executive director of the Komoto Family Foundation. And so what I do is really overseeing the direction that we go as an organization. I lead fundraising efforts, which includes grant writing. I mentor our team of community health workers. And I also develop and nurture partnerships with external stakeholders. So, for example, this includes educational institutions like colleges and universities, K through 12 schools, community-based organizations, public health entities, and things like that.
Wow, thank you so much. That's a lot of duties, but I'm pretty sure you do them well.
It's worth it.
Yes. Okay, so the second question is, can you describe the core goals of the Komodo Family Foundation?
Yeah, our mission is really promoting health equity and healthcare access to the community. And we have a particular focus on pharmacist provided care and care that's able to be accessed through a community pharmacy setting. So we really have three focus areas that we work on. One is outreach, the other is education, and the third is research. So under outreach, this is really how the foundation got started in the first place. Our kind of cornerstone program is called the Affordable Meds Program. So this is our program where our community health workers help patients in the community who have high out-of-pocket costs for their medications to identify resources that can help lower those out-of-pocket costs for them. So that can include enrolling them in patient assistance programs, for example, through manufacturers. Sometimes it's connecting them with patient foundations, diagnosis-based foundations, things like that. And sometimes it's as seemingly simple, but in practice, it's not that simple. Coming up with, ways that they can save some dollars at the pharmacy counter, through discount cards and things like that.
Uh,
So that's the Affordable Meds Program. And then under education, we have done a lot of sort of public health educational efforts for the public, especially on the topics of vaccines. So during the pandemic, we had a lot of educational videos that were talking about how the vaccines were developed, the efficacy and the safety of vaccines, the importance of getting vaccinated, and we continue those efforts, as we move into this sort of post-pandemic world where we still have a lot of communicable diseases, including measles, which is unfortunately having a resurgence due to people opting out of vaccines. So there's that. We partner with, I mentioned K through 12 public schools in the area here in Kern County, and we've done career days, when they have uh, people come in to talk about what they do for a living. We talk about career paths in pharmacy, and that includes both pharmacists as well as pharmacy technicians. And we talk about, these are options in healthcare if that's something that you're interested in. And and then we also do educational efforts for healthcare professionals on how to provide more equitable, more fair, more accessible care for their patients. So we give talks in pharmacy schools, at state and national pharmacist organizations, at pharmaceutical and medical device companies on different topics. For example, bias, stereotypes, and stigma in healthcare, health disparities in the Asian American, Native Hawaiian, and Pacific Islander communities, Hispanic and Latino patient populations, things like that. And then lastly, in our research, we have partnerships with universities to conduct research that ultimately will increase access to pharmacist provided care. So we have a number of peer-reviewed publications on the value of adding pharmacists to the healthcare team. For example, when patients are being discharged from the hospital and they've got real complicated medication regimens. If you add a pharmacist to that team to oversee and kind of manage the medication therapy, how much can that improve the lives of the patients and improve the outcomes for those patients?
Wow, that's a lot of work, and it sounds like a lot of the work is driven to promote health equity. That's what this sounds like.
Yeah, that's
They,
definitely the core goal at all of all of it.
thank you. So the third question is, how does KFF or Komoto Family Foundation identify and prioritize the public health needs of the community?
I think what we try and really ask ourselves on a day-to-day basis is what is the most pressing to the well-being of our patients? And the second part of that question is where are we actually able to affect change? So we partner, for example, with Komoto Pharmacy, which is an independent community pharmacy in Kern County. And we've got, in the pharmacy, there's patients walking through the door. And in the pharmacy, they're doing more than just dispensing medicine. We're finding that a lot of the patients can't afford their copays. Well, that in itself is a red flag. That's telling you that the patient is struggling financially. So that kind of then opens the conversation for other needs. Are they struggling with paying their bills? Are they having food insecurity? Are they needing maybe assistance with in-home care for an aging parent? Things like that. So it's in listening to what the patients are struggling with, what they're asking help for. And that I think is really what helps us identify the needs. And then as far as prioritizing, it's how can we, what can we do to help? What do we have the agency and the ability to help with? So a lot of that is, utilizing the pharmacy as an access point for those for care, for
Hmm.
preventative care. And also even just, picking up the phone. This is what our community health workers do. They make the phone calls, they connect the patient with other organizations that can assist. They find where are the food banks, what are the hours and the days of their operation, things like that. And then kind
Thank
of
you.
like at a more, I guess, macro level, zooming out, we do partner, I mentioned, with a lot of different community organizations. We are also part of the Kern Health Equity Partnership, which is led by the Kern Public Health Department. So at that kind of county-wide level, they are really keeping their finger on the pulse of the needs of the community as a whole. And through that partnership, what we've been able to do is share and also receive knowledge of what are the local resources that are out there in the community so that our CHWs and the CHWs at other organizations through the county can know where and how to provide those linkages to care for their patients and clients. And then lastly, I am a part of a number of different statewide immunization coalitions where our goal is really to drive improved vaccination rates through the state, especially in areas that are healthcare deserts, like our own rural communities throughout the county.
Thank you. So kind of, I think you answered some of these questions, but feel free if you have anything else to add is, how do you measure success? Oh, actually, not this one. Sorry. How do you measure success or impact within the organization?
Yeah, when I think about measuring success, so my master's is in health economics. I'm a health economist in addition to a pharmacist. So I'm thinking in terms of qualitative outcomes and quantitative outcomes. So qualitatively, we're getting, success stories and patient testimonials. When Consuelo helps somebody that has this chronic cough and she's too embarrassed about her symptoms that she's not able to go to church anymore. But that's her faith community, that is her kind of social outlet for this patient. So by helping this patient get to the bottom of that issue, by linking her with the care that she needs, now all of a sudden this patient doesn't have her cough. She's able to go back to church. That is improving her quality of life at that level. When you, Sandra, are helping somebody that has been diagnosed with HIV get access to their medicine. This patient would have otherwise had to come up with $5,000 a month for their medication, but you were able to enroll this person in the ADAP, the Patient Assistance Program, So they no longer have that burden on their shoulders. So it's stories like that, it's examples like that that I think really showcase the impact of the organization, of you guys, what the work that you are doing on a day-to-day basis. And then on the other side, quantitatively, so looking at numbers, we run our reports on productivity, right? And since the Affordable Meds program started in 2014, you guys collectively have helped nearly 3,800 patients save over $5.6 million in out-of-pocket medication costs. This is our tiny team, 3 people. You have made this possible. And so that's just one example. In terms of the kind of research outputs, we have been able to publish papers in 8 peer-reviewed healthcare journals, in 10 peer-reviewed poster presentations at professional conferences. On the realm of education, we presented 27 different presentations on topics related to health equity over the years, and these have reached thousands of healthcare professionals. And then we've also even distributed several thousand coloring books on pharmacy as a career path for children. And pretty soon we'll be launching our vaccination book. So those are, just some examples of how we're measuring our impact.
Thank you. So the fifth question is, what strategies does KFF use to promote health equity in Kern County?
Yes, I mentioned, for example, we partner with Komoto Pharmacy as an access point for care. This is where patients can get not only their medications, but they can get their vaccines. They have access to community health worker or promotora services. So this is related to getting health education on their diabetes. How do you take care of yourself if you're diabetic? How do you take care of your feet? What kinds of nutritional advice do we have to keep the blood sugar under control? And it's also health navigation. So getting them linked with care, with social services if they need to, and things like that. And
Thank
then
you.
it's also through our partnerships with Kern County-based organizations. So Kern Public Health, I mentioned as one example, Kern Health Systems or Kern Family Healthcare, the local school districts, CSUB, Bakersfield College. It's really, us kind of collectively trying to listen to and respond to the community needs in whatever capacity that we're able to. And then lastly, we have just this year, we launched our Komoto Family Foundation Scholarship Program. So this year, we were able to award $40,000 in scholarships to students from the Central Valley who are going to pharmacy school and intending to practice their pharmacy profession in the Central Valley. So this is really our effort at addressing the healthcare provider shortage that we have had for years here in the San Joaquin Valley. And that's our way of kind of doing our part to contribute.
Thank you. The sixth question was talking about how you collaborate with other entities, but I think this question fulfilled that you do have a lot of great collaborations with different entities, and like you said, like it's also like the managed care systems and the academic institutions and things like that.
Mhm.
So so I'm gonna skip. I'm gonna going over to the seventh question, which is, how does Komodo Family Foundation communicate with the public or community members?
Yeah, so we do participate in a number of different community events like health fairs, the holiday parades in Delano, for example. We have done, as I mentioned, outreach events in the K through 12 schools and at the college campuses, and then through our social media channels. So through both the in-person component as well as the virtual, channels, we are able to have that line of communication with the community.
That's good. I think that's really important to get your voice out there, communicate with the community, see what their needs are, right?
Mhm.
So the eighth question is, in your opinion, what are the biggest gaps or challenges in service delivery?
Yeah, so one of the things that healthcare providers are struggling with in this day and age is inadequate payment for their services. So this is honestly a major threat to patient access. So when you start to see patients being turned away from service, from clinics, you start to see pharmacies closing. This is often the reason. People are not going into healthcare to become billionaires. At least most of us are not. I can't speak for the larger corporations. But this is not why providers go into business, right? We're just trying to keep the lights open. We're trying to keep taking care of our patients. I'll just give you one example. So Pharmacy benefit managers, or PBMs, such as CVS, Caremark, and OptumRx. I'm going to name them because people need to know.
Yeah.
These are the health insurance middlemen who are unfortunately forcing community pharmacies out of business. For example, Rite Aid. We are seeing Rite Aid stores closing across the country, and many, many, many independent pharmacies. They're forced to close because these PBMs have unethical business practices. Essentially, what they're doing is they're causing pharmacies to lose sometimes hundreds of dollars when filling a prescription. So this, if in effect, is creating what we call pharmacy deserts. Now all of a sudden patients are going to have to travel miles and miles to the next pharmacy to get their medications. So this is going to create a medication access crisis across the whole country unless we start to enact common sense regulations on the PBMs. One example, I think we're going to talk about policy in a minute, but Senate Bill 41 in California, that's one example of a bill that we definitely should support because all that is doing is having oversight over the PBMs to kind of stop the most egregious practices that they're doing. And, we want to urge Governor Newsom to definitely support that bill.
Yes. And everybody else, if you can support that, please do. I believe you can do that right by going online and
Yeah, we can
just
write a letter to Governor Newsom. We can call his office. The contact information is on his office website.
thank you. So in terms of policy, and I think it goes hand in hand with what you were just saying is what is working and what is not working.
Yeah, what is working is when we do end up getting funding for essential programs, especially those that are focused on preventative health. So when providers are able to get paid adequate rates for things like vaccinations, for example, pharmacist provided care, like being able to provide birth control straight out of the pharmacy, smoking cessation, naloxone, those type of preventative health services, transition of care services for patients that are recently discharged from the hospital and have complicated medication regimens. And even community health worker provided health education and health navigation services. So, as a health economist, I'm telling you this right now, all of these are very cost effective interventions that save money to the healthcare system in both the near term and the long term. And it's really a no brainer. So, what works is when when the insurance companies are paying providers to provide these services, and when they make it easy for providers to, contract with them to be able to provide these services, when there's not too much red tape, too much bureaucracy to get these things set up. Providers are busy enough with patient care and all the million other things that they're doing. So they really need their administrative tasks on the back end to be as smooth as possible. What's not working, unfortunately, I mentioned one example with the PBMs. The other piece is at the federal level. Unfortunately, we're seeing people in positions of incredible power and influence who are going against the science. They are turning public health into a political circus. Access to Medicaid or Medi-Cal here in California is the number one threat. And access to vaccines, I would say, is number two. But then the good news is it's not hopeless, right? Unfortunately, we're in this unfortunate situation, but we're not powerless. We always have the power to speak up. There are ways to contact our local legislators, as I mentioned. There's ways that make it easy. There's an app called 5Calls. If you download this app and you put in your contact information, it'll tell you exactly, okay, these are your senators, these are your congress people. It gives you the phone number. It gives you a script even to read. You pick the issue that you care about, for example, Medicaid. Um, and you just read the script when you leave the voicemail. So
Oh,
there's things that we can do in terms of like changing policy. And there's power in numbers, right? Because the more of
yeah,
us that speak up, the more that they're forced to listen to us.
thank you. The 10th question is how do you involve the community in planning or evaluating programs? And I
Yeah.
think,
So in the past, what we've done is we've done patient satisfaction surveys, for example, with our affordable meds program. And it has been a while, since we've done anything like that. So this is definitely an opportunity for us to be able to revisit that concept and to be able to evaluate the effectiveness of the program.
So the next question is, what role does data play in your decision making and program planning?
Yeah, data really drives where we want to focus our priorities. So, a recent example, First Five Kern, they recently commissioned a countywide survey on vaccination confidence in the community. And what they found is that almost half of the respondents have delayed or skipped a recommended vaccine for either themselves or their children. So, they did some digging into that to try to understand it. And what they found is that those who get their information from a doctor are much less likely to skip or delay vaccines, as opposed to those who get information from friends or family, from the internet, from other sources. And for those that are vaccine hesitant, they reported that if they received more research, more communication, that would improve their vaccine confidence. So what this data, to me, the way I'm interpreting it, what it's saying is that we need to have really a concerted effort by healthcare providers across the spectrum, pediatricians, gynecologists, pharmacists, nurses, community health workers. All of us need to come together and make strong vaccine recommendations directly to our patients. This is what's going to affect change. This is what's going to influence people to actually go out and get their vaccines. And this is really what we need to focus on, especially as flu season and COVID season is upon us. And I think this is a perfect opportunity for us to engage in that.
So how do you support the leadership development of team leaders, including CHWs?
Yeah, I love this topic. So, whenever I find a quality training program, I send the team. We gather the resources together, we get it done. We send, even if it means that you guys have to travel, to get your like CHW training down at USC. We put people up in a hotel, we got people to travel down to LA. It was a lot of logistics, but in the end, it was worth it to get everybody credentialed so that we could begin to provide this service. And then it's also connecting and mentoring at a human level. All of us are facing different struggles in both our personal and professional lives, and we're here to support one another. We have our team meetings once a week where we're able to share our challenges, we're able to share our successes, some best practices, sharing like it's really powerful when one of you guys is able to share what worked for you because then that is instructive to the rest of the team so they can use that as an example of like, okay, if I run into this like a similar type of scenario, then I can try the strategy that Sandra or Consuelo has done. So this enables us to really learn from one another and to exchange those ideas. And then lastly, I would say it's modeling healthy boundaries to support everybody's overall well-being.
I think sometimes we forget to take care of ourselves, so that's really important.
We really do.
Yeah. All right. So the 13th question is, can you describe a leadership challenge you faced on and how you approached it?
Yeah, speaking of taking care of ourselves. So when the COVID pandemic hit, this was really our opportunity to be part of the solution. So, on the good news was that we had a good relationship. We have a good relationship with Kern Public Health, and we were able to leverage that connection with them to be able to get early access to the vaccines. Like as soon as they received it, we were able to mobilize our team through the community pharmacies and be able to give the vaccines to those who were qualifying. And then this really set us off into that superhero mode for about a year, where we were not only giving the vaccines through our pharmacies, we were also going into the fields, vaccinating the farm workers, going into the schools, vaccinating the kids. And after months and months and months of this, I was already beginning to see burnout in all of us, from the staff to the leadership. Like it was just not a sustainable way of being. And so we then had to transition. This was the challenge, was like, how do we transition from hero mode to sustainable mode? And it goes back to setting boundaries, being able to discern where to really spend our limited time and our limited resources and our limited energy. And it's also even being able to discern when certain partnerships are more one-sided and we end up having to decline. So previously, I would say our old paradigm was to default to always saying yes to new partnerships, to opening all the doors that we could. But we got to a point where we realized we can't be stretching everybody so thin all the time. We have to prioritize the well-being of our whole team so that we can do the best that we can with our limited resources. For example, we've been recently asked to do mobile vaccination clinics without payment to cover our staff time. That is not a sustainable solution. So we need partnerships that we're going to be able to serve the community for years to come. We can do pilot projects through grants. And then we need to look at then what are the long-term resources that we need to keep it going. So a lot of that is going back to, the insurance companies. What services are they willing to pay providers for? And is it adequate to keep the program sustainable for the long run?
Thank you. So we've approached our last question, and this question is, what leadership qualities do you believe are essential for driving community-based health initiatives?
First and foremost, I really believe you have to lead with your heart. We use our brain for sure. We use our brain for problem solving, but the heart has to be the leader because if your heart's not in it, then all you're doing is going through the motions and checking the boxes. Unfortunately, we're seeing a lot of burnout to this day in a lot of healthcare institutions. And that's really the reality of being underpaid, being understaffed, having a waiting room full of patients to get through. And this is going to lead people to have that lack of compassion and a lack of care. So there's systemic factors at work, you know, and then also like internally as a leader, you kind of have to get creative and get resourceful and find ways to keep everyone engaged and motivated. And everyone on your team has to share that same heart, that same passion for the community's well-being. And you have to remind yourself and remind everybody why we're in it in the first place. We have to keep sharing those success stories of making a difference, of how we're helping prolong people's lives, of helping improve their quality of life, and how we're taking some burdens off of our patients' shoulders, because that's really the intrinsic reward of us who chose to work in healthcare and who continue to work in healthcare.
Thank you so much, Danielle, for taking the time to answer these questions. And I just really wanted to also like showcase how powerful local nonprofits can be. Of course, we have like these other organizations, but local nonprofits do a lot of work too. And we have a lot of good public health initiatives and the collaboration, like the staff. So like you said, we are a small team, but we're a mighty team. And the work
Definitely.
shows like, yes, we have done a lot of impactful work. So thank you so much for taking your time.
Thank you.
Thanks.